How do healthcare teams ethically deliver difficult lymphoma news? When facing tough news about lymphoma, such as non-Hodgkin lymphoma, healthcare teams focus on honesty, respect, and compassion. They understand that delivering difficult information requires careful thought and sensitivity. The first step is always truthfulness. Patients have the right to know their diagnosis and what it means for their health. Healthcare providers aim to share information clearly and sincerely, avoiding any distortion or withholding that could harm trust. They also consider the patient's readiness to receive news, sometimes sharing information gradually or in parts to help them process it better. Communication is tailored to each person's emotional state, cultural background, and preferences. Providers often ask how much the patient wants to know and involve family members when appropriate. This respects the patient's autonomy while providing support. It's important to balance honesty with hope. Doctors explain the nature of lymphoma, possible treatments, side effects, and realistic outcomes without giving false optimism. This helps patients stay engaged and hopeful while understanding the challenges ahead. Healthcare teams follow ethical decision-making frameworks that consider medical facts, patient wishes, quality of life, and individual circumstances. They often work as a team, including doctors, nurses, social workers, and counselors, to ensure the patient receives comprehensive support. Nurses, in particular, serve as advocates, helping patients navigate emotional reactions and ethical dilemmas. Cultural sensitivity plays a key role. Some cultures prefer family-centered disclosure or partial information to protect the patient. Respecting these preferences while still upholding the patient's rights is essential. After delivering bad news, teams provide emotional and psychological support, offering counseling and resources to help patients and families cope and make informed decisions. Maintaining professional boundaries is also important. Providers make themselves available for questions and ongoing support, ensuring the patient feels cared for without overstepping. Many clinicians use structured communication tools like the Spikes model, which guides them through setting up a supportive environment, understanding what the patient perceives, inviting questions, sharing knowledge clearly, responding to emotions, and planning next steps. Overall, ethical communication about lymphoma involves honesty, respect, and empathy. It promotes informed decision-making, minimizes harm, and supports emotional well-being. By following these principles, healthcare teams help patients face difficult news with dignity and hope, always prioritizing their individual needs and preferences. Remember, each person's experience is unique, so personalized care and professional guidance are always essential.